Good morning and welcome to Health Talk, sponsored by Mon General Hospital. This program is designed to provide education on vital health topics to help you take charge of your health. You'll also be introduced to Mon General's committed physicians, allied healthcare professionals, and quality programs and services. And now, here are your Health Talk hosts, Kay Murray and Jim Stallings.
Good morning and welcome to Health Talk on WAJR, brought to you by Mon General Hospital. I'm Jim Stallings along with Kay Murray, and today we're going to be talking about pain management with Dr. Michael Fussell, Interventional Pain Institute. He is a pain specialist. I'm Jim Stallings again. Good morning, Kay.
Good morning, James.
And good morning to Dr. Fussell. Welcome to the program. We are going to be talking about pain management today. So let's first talk about chronic pain. And what is the definition of chronic pain?
Well, chronic pain is what's defined as pain that you experience for at least six weeks. Some people say 6 months, but basically it's about 6 weeks.
All right. So is this something that people usually have some kind of trauma with, or can it be something that's developed without trauma?
It can come from all areas. It can be from trauma. It can be from a work-related injury. It can be from degenerative changes, from any kind of pain.
All right.
Well, I just want to talk about the different types of pain management. Most of us will just go forward and take Tylenol or Advil or whatever's going to make us feel better. When comes the point that we say, okay, we can't do this on our own, we need to get some assistance?
Well, after you've experienced that pain over a period of time, and first you want to go and talk to your primary care doctor and find out what could possibly be going on. And then once they do a workup with MRI, CT scans, X-rays, or whatever, and they find that just the conservative measures aren't working, they want to do a little bit more advanced treatment, then they'll send you to interventional pain management.
You know, it's just really interesting you talk about CAT scans and MRIs, because recently we heard where a lot of these examinations and these X-rays may not be necessary. We're just sending patients to go have it done. And also talking about the scare of too much of the rays and how it can affect the body. How do you respond to that?
Well, first, that's why you want to go and see your primary care physician, and typically they'll be the ones at the helm that will be able to discern whether you need that particular diagnostic test or not.
So we need to just trust who we're dealing with and trust our doctor and know who he is.
Correct.
And have that confidence. I guess the most common type of pain would be the back. You hear a lot about, oh, my lower back hurts. And is that one of the more common type of pain managements that you deal with?
Yes, it is. And that's primarily what I see. That's the bulk of what I see. And it's pain, it's pain that stems from things like what people call sciatica, low back pain, SI joint pain, things like degenerative disc disease, spinal stenosis, and things like that.
But if you prescribe medicine, that's just masking the problem, isn't it? And it's really solving the problem?
Correct. That's not my primary focus. What I typically do are interventions, and hence the name Interventional Pain Institute. That's the name of my practice. I try to treat the pain and not just cover the symptoms. Pain medication is indicated in certain situations. And that's typically what I decipher to figure out, what's best for you. Is pain medicine the thing that should be used in your treatment, or the interventions that should be used?
When we talk about sciatica and lower back pain and those types of things, I've found, or at least I think I've learned, that a lot of that has to do with the spinal cord and all the nerves going through the spinal cord. And I had a sciatica nerve problem one time and had an adjustment without medicine, and it seemed to work. I mean, is that kind of what you do to try to determine exactly why the pain is there and then how to manage it?
Yes. What I do is I look at MRIs, and that's the main thing. That's the best diagnostic test for me. X-rays really don't tell me a lot of information. They are useful, but not for what we need to see. CT scans also help, and that will you'll be able to see if there's something pressing on the spinal cord, and that's typically what sciatica comes from. When you have something pressing on that sciatic nerve, which is basically a group of nerves at the lower end of the spinal cord, that come together and form one big nerve that goes down and controls your legs. So if you have something pressing on the cord up there where those nerves originate, you'll have pain down your leg and what people call sciatica. So with the MRI, you'll be able to see if something's pressing on that cord, and that's typically what we treat. And I don't do adjustments. What I do are primarily injections.
Injections of?
Steroids and anesthetics.
And how does that work? I mean, how do the steroids treat that problem?
Well, if you have something pressing on the cord, it usually causes the cord to be inflamed and irritated. Steroids are a potent anti-inflammatory. They can decrease that inflammation and irritation and in turn give you pain relief.
But is that just a temporary?
Yeah, I was going to say, isn't it something then still pinching the cord, or is it going to develop later?
Well, yeah, you won't. The steroids don't change your anatomy, but to change your anatomy, that's typically surgery. And most people don't want to have surgery or not good surgical candidates. If that entity is pressing on the cord and not really causing a huge problem, you go see a surgeon, and they won't recommend surgery. What they'll recommend is you try and treat it with injections first.
And people want relief, that's for sure.
But if it's an anti-inflammatory, how long does that last? How long does an injection work on keeping that from getting inflamed?
Well, it all depends on you and how you respond to the steroid. Some people get a year plus, 6 months, 6 days, and it's possible you might not get any relief from it. But if it does, you can have it repeated. You can have it repeated up to 3 to 4 times in a 12-month period.
I was going to say, you can't do it very often, can you?
No,
so
like I say, 3 to 4 times.
How are they dangerous?
No, they're not very dangerous. They're very safe within those time periods of treatment.
But steroids, is that good for your body? I've always heard that steroids can break down your immune system.
Well, they can, and typically you get those responses, those negative responses, when you take them by mouth on a chronic basis. This is designed to stay inside the spinal cord and treat right there. Your bloodstream is going to pick up some of that steroid, true enough, but it's designed to stay right there in the cord and do its work right there, the treatment.
Where are you located, the Interventional Pain Institute? Where are you located in Morgantown?
We're located at 1288 Suncrest Town Center in Morgantown.
Oh, okay, at the new Suncrest Town Center.
Another office at the Suncrest Town Center.
They're really becoming a medical facility there.
And
there are quite a few offices.
Are we generally referred to you by our doctor, or can we just walk in and say, I've got some pain?
Well, that's the best way, is to be referred by your physician, because what I need is to look at that MRI, and typically your primary care physician will be the one that'll order that MRI. So if you have one already, you'll be able to get in. But if you don't, it's best if you have a primary care physician refer you. And I like to have a primary care physician on file so we can stay in contact with them, so they know what we're doing, and it can be
And I'm sure we started out with that primary care physician, and he's done some things, but it just hasn't solved the problem. It's just when he sends us to you then to try to get more relief.
Correct.
That way you'll know what he's done and what we've been through. And how many injections did you say you can get? Because that really surprises me. I thought it was only like 1 or 2 a year.
up to 3 to 4 in a 12-month period.
In any part of the body or different parts? I mean, like if you give one in my back, can I then get one in the shoulder?
Yes, you can.
Okay.
Yes, you can.
We know how medicinal pain relievers can become very addictive, Oxycontin, those types of things that are prescribed. And again, you don't treat pain that way. With the steroid injections, there's no addictive qualities to it, are there?
Not really. And I do treat with medical management with medications. I do in some cases. Typically those patients who've gone through my treatment plan and have failed, not surgical candidates, and they're still in pain. So I do treat with medications.
You're listening to Health Talk on WAJR. Dr. Michael Fussell is our guest this morning. He's a pain specialist with the Interventional Pain Institute. Health Talk brought to you by Mon General Hospital. We'll be back right after this break.
This is Mon General's Health Talk. If you have a health-related question, call us now at 304-296-0041.
Welcome back to Health Talk, brought to you by Mon General Hospital. Dr. Michael Fussell is our guest this morning. He is a pain specialist.
Yes, he is. And we've talked about medications, we've talked about injections, but in treating people with pain, what other ways do you treat?
Well, there are other interventions that we do for those people who failed injections, not a surgical candidate, and they still have chronic pain, and that's with spinal cord stimulation. And
Explain that. What is that?
Well, what I do is a 7-day trial period, and that's where I'll insert a lead with that emits electricity over the spinal cord, and basically the electrical signal outruns the pain signal to the brain, so your brain doesn't see the pain signal. And you're able to control that stimulation. You can turn it on, off, up or down, and you'll have it for 7 days. And you'll be able to see how well it manages your pain. And if it does manage your pain, I take it out after 7 days, and you're back to normal. And you'll be able to discern whether it worked or not, and you want to have it implanted permanently. And typically, I send you to neurosurgeons who implant it permanently, and you'll have a remote control that you'll be able to control that stimulation and control your pain.
That's amazing.
Yes.
Have you heard of such a thing? I know someone right now that's suffering with some pain in her hip down through her leg, and this has been going on for about 2 years now. And she's been to a chiropractor, she's had the MRI, she's had the CAT scans. They just can't pinpoint what is causing this problem for her. So what you're talking about today sounds like something that you might be able to pinpoint that.
Yeah, she would be an excellent candidate for a spinal cord stimulator trial.
Yes, it sounds like it.
We have a phone call from Bill. Hi, Bill. You're on Health Talk. Right ahead.
Good morning. I'm a patient of Dr. Fussell, and back in the summer I had a pain come up on my left side hip. And anyway, I went to Dr. Kurth. I lingered with it for a few months, and then went to Dr. Kurth. He referred me to Dr. Fussell. And Dr. Fussell, in my opinion, is an outstanding doctor. He explains everything you'll go through and all this, and he walk you through what you can expect about the pain. It might go away, might not, but anyway, it went away. I'm doing fine. And I had a sciatic nerve problem hit me in March last year. So anyway, I wish I'd have known Dr. Fussell at that time, because I can only sing praises for that man. And I'm doing, I want to say I'm doing fine, Dr. Fussell, and thanks to you.
Hey, thanks,
That's
Bill.
it.
And not
All
a
right.
planned call.
Another
Very nice.
satisfied customer.
Thank you, Bill. I tell you, no one likes to be in pain. A chronic pain, it can affect your entire life. It truly can.
And the topic of sciatica has come up a couple of times on this program. Is that the most common type of pain that you treat?
It is fairly common. We also have neck pain from herniated disc, spinal stenosis.
But again, we don't have to live, whatever the pain is, we don't have to live with it. I mean, you're in the business of managing the pain, which means living with the problem, or I guess you're not living with the problem, but you're easing the problem.
Correct.
What do I expect on my first appointment? When I come in and my physician has sent me to you, what can I expect? What happens on that first appointment?
Well, typically your first appointment is just an evaluation. I'll review your information and your diagnostics. We'll talk about what happened, how long it's been, the kind of pain you've had, things you've done to try and treat it up until that point, and we'll come up with a treatment plan. And typically we'll have you come back and we'll schedule an injection. I do my injections typically twice a week on Mondays and Thursdays. And I see new patients on Tuesdays and Wednesdays, and I do follow-ups Thursday afternoon and Fridays.
And again, not the only thing he does.
Mondays and Thursdays are good injection days, are they?
Yes.
Is there any particular reason why?
Because he's there to do it.
You're there to do it. And a matter of fact, you got to get back to the office this morning.
It's
pretty
Thursday
soon.
morning.
Yeah. So we're going to let you go. Thank you so much for the information this morning.
Yeah, interesting. And again, you wanted to mention?
Well, there are a couple other procedures that we do. I mean, I do a lot, but the main ones are radio frequency neurolysis, and that's where people with back pain in their joints and their back, there's a little nerve that we can go in and ablate or burn with radio frequency waves that will relieve a lot of pain. There's also a new procedure that we're getting credentialed to do at Mont General, and it's called the mild procedure. It's the minimally invasive lumbar decompression, and that's where I can go in with a needle and decompress the spinal cord and take out some of that material that's pressing on the cord that typically the surgeons do, and that with a laminectomy, and we can do it with the needle, and it may avert possible surgery. And you still can have surgery if that procedure doesn't work. So that's a new procedure on the horizon that's really helping a lot of people that I'll be able to do.
Yeah, a lot of sounds like new ideas, new thoughts there.
Yes.
And again, you're at Suncrest Town Center. Are you above Five Guys Burgers or anything? You smell what
1288. No, we're right above the number one super buffet and a Buffalo Wild Wings. So
you smell what they're cooking.
Yeah, we're on that end.
Yeah.
All right. Thank you so much for coming in today.
All right. Thank you for
We
having me.
appreciate it. Dr. Michael Fussell, our guest. And coming up in the next segment, we're going to be talking about a seminar coming up, non-surgical treatment of arthritis. So if you suffer from arthritis, make sure you stay tuned and don't go anywhere.
This is Mon General's Health Talk, providing the information you need to take charge of your health. Call us now with your health-related questions at 304-296-0041.
We're going to move from pain management to non-surgical treatment of arthritis. That's the topic of a seminar that is coming up. And with us on the program today to talk about that is Kara Weaver of Mountaineer Orthopedic Specialists. Good morning, Kara.
Good morning. How are you?
Doing just fine. We have a few minutes to spend with you. So tell us about this seminar that's coming up on April 25th.
Okay, well, this seminar is going to be held at Mon General in the Milan Room on April 25th at 5 p.m. And basically, the purpose of the seminar is to educate the community and patients around this area that are dealing with joint pain and arthritic pain. And basically, our point is to, educate them on, ways that we can maximize their function, minimize their pain, and ultimately avoid the risk of surgery. Everybody goes to an orthopedic surgeon, with the nerves of hearing that they're going to have surgery, when ultimately there are many ways that we are able to treat patients non-operatively, and the seminar is basically to get the word out to the public that, there are these other options, and we are more than willing to, pursue those options.
I wanted to, actually, a second thought question asking you, the Center for Non-Surgical Treatment of Arthritis, what is it that you do? But I think it's all right there in the title. It's a Center for Non-Surgical Treatment of Arthritis.
It's kind of self-explanatory. It's basically a program that we've developed. Me and Dr. Post have both kind of developed it, and it's still in the beginnings, but basically the point is to help those patients that are, ultimately trying to avoid surgery. And, there are, like I said, many options that we have non-surgically that can potentially get patients back to their, usual function and with minimal pain. And, that way, ultimately, we can avoid the surgery.
What are some of the ways that we can manage arthritis?
Multiple ways. A lot of people have heard of some of the over-the-counter stuff, supplements and stuff, and, there are particular ones that have been proven to help. Some have been just, not as proven to help. So we kind of go over which ones are good, which ones are worth your money, which ones are worth a try. We basically go over, some of the activity modifications that may need to be done with your daily activities to avoid aggravating the arthritis. Then there's even, pursuing physical therapy options, which a lot of people think, if I go do physical therapy, it's going to make it worse. But a lot of people have found that exercise in arthritis is actually beneficial for the pain and function. There's even things such as braces and different supports to help, with arthritis you have some deformities that occur, and sometimes the braces can help relieve a lot of the pain and pressure.
Can arthritis happen in any joint in the body?
Yes, it can. It can virtually happen in almost any joint. And, most commonly people think of, arthritic knees, arthritic shoulders and hands, and, there's certain areas that are more common than others just because of how much we use them. But it can happen in any, and like I said, every joint's a little different, so there are different options of treatment for different joints.
So my grandma's remedy of gin-soaked raisins probably isn't something you would recommend, or maybe you do recommend
not
gin.
Necessarily recommended, but we have heard that before. We've had a few patients coming in saying it works for them. So,
my grandmother swore by it, but then again, sometimes she just didn't put raisins in the gin and just had the gin, and it seemed to help her arthritis a little bit.
If it helps, that's all that matters.
But it seems in the last year or so, I've developed a pain in my right shoulder. Sometimes it hurts to sleep on it, and I don't know if it's arthritis or not. So I guess we could come to the seminar and learn more about that, huh?
Absolutely, absolutely. We can learn about it, and then, ultimately it does potentially take a visit with one of us, and we will, at that point make sure that you have arthritis, and, and make sure, because ultimately, getting the correct diagnosis is the most important. So, be doing basic things such as x-rays and a physical exam is important too, and, that's part of what we can do for you as well.
All right. The seminar is going to begin at 5 p.m. April 25th in Mon General Hospital's Hazel Ruby McQueen Conference Center. Do we need to make any reservations?
That is correct. You
got 10 seconds. Tell me yes or no.
You can come as is, or you can give the office a call at 304-594-0456.
Thank you so much. That's Health Talk on WAJR.